Hi everyone, welcome back to Behind the Sirens SA. I am your host, Nomtimvula. Can you believe that we are officially 2 months into this podcast and we already passed 500 subscribers? And that is insane. So I would like to begin by saying thank you so much for every single one of you who has tuned in, who has shared an episode, who has sent a message, and who is actually taking their time to listen to this podcast. You guys are the real MVPs. So since it's the start of the new year, I told myself that everyone is setting goals. And if you've listened to the past episode, you know that in this show, we actually have goals and we're making resolutions and we're also talking about new beginnings as well. But in EMS, same old emergencies. I mean, I feel like the calendar changes, but the calls remain the same. That is in EMS, of course. So today, I would like to talk to you about the predictability of calls. I've been in EMS for the longest time that I remember, and the calls remains the same, So the cases really never change, and I want to give you some tips on how to stay sharp and most importantly, how to keep the patient alive. Like, why do I still love my job till today? Because yes, this field is demanding, but my passion for it still alive. I'm sure you would think that with the new year, we get maybe new emergencies, right? You are wrong. In EMS, some things, they don't really change, EMS are like clockwork, basically. They happen every single year without fail. So let's talk about those emergencies. For example, number one, as the new year starts, we know that there's New Year shenanigans, I would call them, and we already know that when it's New Year's, we started with your alcohol-related calls because New Year is actually basically the Olympics for EMS. People are celebrating, they're overdoing it, and the next thing you know, we are responding to alcohol poisoning, or we are responding to drunk and driving accidents, or people are just passing out because they actually overdid it, overdrank the alcohol, And what about the holiday-induced incidents, So I'm reflecting back on 2 months, that is 2024, December and January. Basically, that is full of I can do myself injuries, People are climbing ladders, fixing Christmas lights. People are painting their houses, people are setting off fireworks, and the classic holiday might drink, where people trying new things that they've never tried before, and the moments turn into ER emergencies, and they call us as paramedics to come and help. So let's not forget the food poisoning, because with the Christmas leftovers, with the New Year's Eve, with the New Year's lunch, people are actually trying new things that they've never tried before. And those emergencies are always there, yearly. They actually never change. Then we are into January again. Every year, people are signing up for gym memberships and go all out, for the first week of January. Then boom, they have muscle strains, they have dehydration, even heart issues. Pace yourself, guys. There is no rush. It's still just 1 month into the year. And we also get chronic flare-ups, It's all that time of the year whereby now we have hypertension cases, diabetes, heart conditions spike again, and especially in patients who might have gone off their meds during holidays, because there are patients who actually stop drinking their medications because it's holidays. And us in EMS, we end up dealing with a lot of high blood pressure emergencies, a lot of strokes and diabetic episodes, because some they eat when they're not supposed to eat. They don't even pace themselves. They end up saying, okay, let me taste this, and the taste that ends into something else. So what's the most predictability call that I've ever responded to? I can't tell you, but if you have, please hit me up on my Instagram at nomti_mvula, or right here in the comment section. I want to hear your story. Like, what are your most predictable calls? As I've mentioned mine, I also want you to tell me in the comment section, what are yours? So with so much repetition in EMS calls, how do we then keep sharp? That's today's question. How do we make sure that we're not just going through emotions, Because let's be real, if you've been in so many calls and you've responded to your 50th call and the patient is just telling you that I just have a headache, for example, it's easy for you to switch to autopilot. So here is what works for me, and I would like you also in the comments to share if you have something that works for you. So number one, I always learn, always learning, because even if the calls are the same, as I've just said, medicine is always evolving. So I want to make sure that I stay updated with the new protocols. Let it be new guidelines, let it be new journal articles and new equipment, and there's better ways to doing it. I also attend your CMEs where there's always some discussion about what is new. Okay, that is number one. Number two, which is my favorite. Oh, number one is my favorite as well. But yeah, I stay physically fit and mentally fit, meaning that, yeah, I do exercise. Not as often as I would like to, but yeah, because this job is demanding. And it being demanding, it's easy to burn out if you don't take care of yourself, So please make sure that you hydrate, you stretch, you get enough rest, and take your mental health seriously. And in the future episode, we are going to take a look at how to deal with the, mental health, or how to keep yourself healthy mentally and physically. With that being said, let's jump to number three. Number three, treat every patient like your first. No matter how many times you've seen the same symptoms, it's the patient's first time experiencing it, So show up with the compassion to each and every call or each and every patient that you go to. So let me not bore you with my tips. Let's just jump into how to then keep the patient alive in EMS. So EMS can be draining, as I said, mentally, physically, emotionally. Some days you don't feel like you've got this. You don't feel like you want to do this. But it's also one of the most rewarding careers out there. I am the witness. So how do you stay passionate about a job that can sometimes feel repetitive? It's a MVA, it's a chest pain, it's diabetes, it's hypertension. So you feel like when they give you a call, you're like, I know this. But then how do you then keep the patient alive? So tip number one, find your purpose beyond the sirens. That is number one. Whether it's mentoring new medics, it's sharing your experiences like this podcast, or even just making someone smile on a bad day. These moments matter. Number two, remember your why. Basically, why did you start this journey? Whenever you feel exhausted, please make sure you go back and ask yourself, why did you fall in love with the EMS in the first place? Because that will help you reset and focus on what you're doing. Another thing is to celebrate the wins. We focus so much on what went wrong most of the times. But what about the lives that you've saved? The good calls, the grateful patients, you know? Sometimes just take your time and appreciate those moments. At the end of the day, EMS is unpredictable and repetitive call all at once. So don't get me wrong. And I think that's what makes us special, or that's what makes it special. A new year for us doesn't mean new emergencies as such, but it's a new opportunity to keep learning. It's also a new opportunity to grow, you know. It's also a new opportunity to making an impact. So with that being said, thank you for tuning in. Please don't forget to subscribe, leave a review, and let me know what is the most predictable call you've ever responded to. And also, don't forget to drop your comment in the comment section. Until next time, stay safe and keep making a difference.